Welcome back. This is Dr. Christopher Jackson, PhD, DO in Florida. And we are here at A Path to Wellness talking about the syndrome or disease of schizophrenia. And to elaborate on what I was introducing there is a field known as orthomolecular medicine, which is not well known, perhaps, which only about 1% or less of physicians in the country actually practice. I do have that as part of my practice, and it does expand into not just physiological disorders, but also psychological, and then we call that orthomolecular psychiatry. So, in treating somebody holistically, we're dealing with the whole person. And in a lot of cases, when I'm treating somebody who has a physiological disorder, they also, either as a result of that disorder or in addition to that disorder, have psychological issues that need to be dealt with. Quite often, for those purposes, I refer them to a psychologist or counselor, or even sometimes a psychiatrist. However, I have found it sorely lacking in terms of the psychiatric community to actually address the root cause of issues. Primarily, the focus is on subduing the individual's body and mind, causing it to change their perspective. But often that can lead to sort of collateral damage or side effects. And since the early days of the 50s, there was a theory by Abraham Hoffer, and it's not Abraham, but Abram, A-B-R-A-M, Hoffer, and Humphrey Osmond, who defined a potential biochemical origin for schizophrenia. They referred to as adrenochrome theory. And adrenochrome is basically a metabolite of adrenaline. So it's a result of the production of adrenaline. And as I've seen, many of the cases that I've seen in terms of schizophrenia have been triggered by a stressor, sometimes a major stressor in the individual's life. And so you get this result of all of this stress manifesting in a disorder known as schizophrenia. And orthomolecular approaches began with substantially with Nobel laureate Linus Pauling, a winner of 2 Nobel Prizes. He initiated the field of orthomolecular medicine and coined the phrase orthomolecular, meaning right molecule. In other words, finding the right molecule for the job. So it's an evolving specialty, especially orthomolecular psychiatry is still evolving, but both are still evolving, both medicine and psychiatry, in terms of addressing the psychological disorders. Though this has not become mainstream, but is increasingly being filtered in to mainstream. Still, conventional medicine typically approaches this disorder with drugs that are meant to treat the symptoms and not the underlying root causes of these disorders. And an approach based on nutrition and precursors to brain and neurological function may be the answer, and that's what this is all about, truly addressing the underlying causes. So the conventional approach tends to focus on correction of symptoms rather than treatment of underlying causal factors. Treatment of symptoms may lead to a patient who feels better or is adapted better to social norms or societal norms, but whose long-term success is tied to the use of toxic drugs that damage the workings of the human body. So you've got something being taken that makes you feel better while your body falls apart, basically. And certainly the root cause of the disorder is not being addressed. That's what orthomolecular psychiatry and orthomolecular medicine are all about, is getting to the root cause and treating that cause. So addressing the underlying physiological basis of each disorder, the root cause, via orthomolecular medicine or psychiatry, provides hope for a true cure without dependence on refined chemicals. That's what it comes down to. Now, I'll give you a kind of an incidental example. Okay, I had an individual come in with his family who had schizophrenia, had been diagnosed with schizophrenia. And we did some testing on him. And the testing showed, I did a hair analysis on him, in fact. And that test showed that this individual had 2.5 times scale of aluminum. In other words, we shouldn't see any aluminum in a human being, okay? But the aluminum content of this individual's tissues was so high, it was phenomenal how high it was. Well, aluminum is a conductor. We have brain activity, which is electrical, and we have aluminum in the tissues. What's going to happen to communication? So you have a conductor that's going to change the normal electrical patterns in the brain because of that elevated level of aluminum. And that is my belief as to what the cause of this individual's schizophrenia was. So it may be that schizophrenia has many causes that look similar in terms of their manifestation, in terms of the symptoms. But the cause may be very different from individual to individual. And so one of the ways that I approached that individual was to start working to reduce the level of aluminum by not only by changing diet, but changing some of the hygienic habits, like using an aluminum deodorant, deodorant with aluminum in it, that is, by using soda cans, all of the aluminum sources in his life, to first of all stop that exposure, and then work on the use of some of the minerals that help to reduce or are antagonistic to aluminum absorption. That's the approach you can take in a situation like that. That's actually treating the root cause. So that's one example for you. So figuring out what the right molecule is, or what the right deficiency or excess might be to treat, can help us treat the underlying cause. And that individual naturally becomes better. Their syndrome reduces in its strength because of actually treating the cause. So the fundamental theory and application of orthomolecular medicine to psychiatry, particularly schizophrenia, may help to expand the influence of the natural approach, okay, the natural holistic medical approach to disorders, if people are actually paying attention and giving it its deserved time and experience or chance to actually show itself what it can do. And unfortunately, our hospital environments are very much run by conventional approaches based on acute or emergency medicine, primarily. So it's all about symptoms. And so we don't get into the root causes very much in the conventional approach. And therefore, we're ending up with people who are being treated for their symptoms and not at the root cause. And it's funny because, you know, I think winning 2 Nobel Prizes would give this guy, Linus Pauling, some clout. You would think that orthomolecular medicine would be worth taking a look, considering that it's been around, you know, quite a while, about, 4 or 5 decades now. There are some people who do apply orthomolecular treatment to different syndromes, both physiological and psychological. There's been lots of studies involved and so on. But generally, those studies are not funded by organizations like the, you know, National Science Foundation or these highbrow scientific foundations that will fund drug research or research on techniques in operations, you know, because there's money in those. And if you're actually treating somebody by addressing the root cause and using nutrition, there's not a lot of money in there. So the funding doesn't happen. And this is part of why it's not prominent like I believe it should be in our society and in our medical system and psychological system as well. So, you know, the fundamental theory and application of orthomolecular medicine to psychiatry, particularly schizophrenia, may help to expand the influence of the natural approach and could be very beneficial to complement the current approaches. So, you know, using the sort of cookbook dissemination of potentially harmful antipsychotics, SSRIs, and all these other drugs, we could at least offset some of those side effects by looking at why those side effects exist. For example, what damage are they doing to the biochemical makeup of the individual?